2F. Obesity in BBS, Mechanisms and Treatments. Dr. Elizabeth Forsythe, Dr. Lukas Foggensteiner and Sarah Flack. Obesity in BBS. Dr. Elizabeth Forsythe stated that obesity is increasing worldwide, partly due to the easy availability of high-calorie food that has been designed to make us want to eat more of it, as well as genetic factors that contribute to our weight. In the medical field, the terms overweight and obese are specific terms defined by the World Health Organization, WHO, relating to BMI. Overweight is a BMI, that's body mass index, of between 25 to 30, and obese is a BMI of over 30. Data from the BBS clinics shows that, like the general population, individuals with BBS experience weight gain with age. At the BBS Adult Clinic in Birmingham, 10% had a healthy BMI, 20% were overweight, 27% were obese, and 50% were severely obese. Individuals with BBS often experience heightened hunger, hyperphagia, compared to others. Normally, signals in the body communicate with the brain, assessing whether the body has enough food. If more food is needed, the brain signals hunger. In BBS, these signals malfunction, leading to feelings of hunger even when the body doesn't require more food. Besides increased hunger, certain eating behaviours contribute to obesity, including stress eating, habitual eating, boredom-driven eating, and other complex behaviours associated with autism. How can we treat obesity in BBS? Obesity can be treated with diet, exercise, medication, and psychological strategies. Exercise is crucial not just for weight management, but also for mood balance, brain sharpness, and reducing the risk of or delaying dementia, heart attacks, strokes, and more. Unlike medication, exercise provides comprehensive benefits for the body. Dr. Elizabeth Forsythe encouraged attendees to embrace a physical activity in the next few weeks, challenging them to share their experiences at the next conference. In addition to the BBS clinics, there are obesity clinics available for both adults and children to address weight-related concerns. Patients can be referred to these clinics for ongoing support and guidance between BBS clinic appointments. Dr. Foggensteiner spoke about weight management drugs and presented results from case studies of BBS patients prescribed semaglutide, known as Wegovy, which showed significant weight loss and improved well-being. However, progress was disrupted because of supply issues. An international trial studied the effects of another weight loss drug, setmelanotide, on hunger and weight loss in adults and children with BBS, with positive results. Participants over 12 years old experienced a weight loss of greater than 10%. At the time of going to print, it is unknown when setmelanotide will be available for those with BBS in the UK. Diet and exercise. Sarah Flack shared the importance of individualised dietary advice for people with BBS, whilst recognising that common factors include lower energy needs, increased hunger, hyperphagia, and food-seeking behaviours. Sarah shared positive results from the Children's Clinic at Great Ormond Street Hospital, GOSH or GOSH, with over half reducing their BMI between clinical appointments, showing that an increase in BMI in childhood can be avoided. Sarah highlighted the challenges for children and adults with BBS in managing their weight due to excessive hunger and encouraged people to be kind to themselves and to keep trying their best. Making lasting changes to our diet or activity level takes time, and we should try to remember that new habits take a few weeks to stick. Don't expect to jump into a new routine without hiccups. Try tackling one thing at a time and aim for those small victories to build momentum. Other helpful tips include 1. Sleep well. Lack of sleep can lead to craving higher energy foods like biscuits or crisps. Try cutting back on caffeine in the evening and going to bed a bit earlier. 2. Smart drink choices. Swap high-calorie drinks like fruit juice or fizzy drinks for water. 3. Portion control. Use smaller plates and fill half your plate with vegetables. And 4. Move more. Find something active that you enjoy. Sneak in bits of activity during your day. Set realistic goals. increase gradually, and appreciate the benefits of being more physically active. Sarah emphasised the importance of sharing your eating, drinking, exercise and sleeping habits with the BBS Clinics team, who are there to help you.